Some of the most vocal critics of the president's health care plan have begun calling it a socialist Ponzi scheme. Tonight, Chief National Correspondent Jim Angle looks at how the law appears to have at least one component of infamous swindles, robbing Peter to pay Paul.
At the University of Pennsylvania,
a former health advisor to the Obama administration argued on Fox News Sunday that the wave of policy cancellations is justified because they were substandard and that people who held them might need uncovered care, which would simply shift their costs onto others.
They're uninsured or they have very low insurance. They transfer those costs to the rest of us. That's the whole point of part of Obamacare, to eliminate this cost shifting so people assume individual responsibility.
But Obamacare doesn't eliminate cost shifting, it magnifies it, because the new health care law is a massive cost shifting exercise itself, forcing the young to pay more for the old, the healthy to pay more for the sick, and even men to pay more to offset the costs of women.
Premiums are going up because they're allowing people to come into these markets who are already sick, and they're unable to charge them a higher price because they're sick. So those costs get shifted to everyone else.
For example, older people can only be charged 3 times as much as young people, far less than the costs older people generate.
And what that means is that younger people are subsidizing older people in this law because healthcare costs for older people run more than 7 times more than the cost for younger people.
Older and sicker people who tend to have more money, ironically enough. And that is why Obamacare has an individual mandate, because it's trying to force young and healthy people to take that bad deal.
And health analyst Jim Capretta said on Fox News Sunday, many plans Obama allies call substandard are not only what many individuals want, they also offer plenty of coverage and would not have shifted costs.
Lots of insurance plans out there today that are covering hospitalization, doctor services, drugs. They're in the individual market. They're regulated by the states. They don't need the federal government telling them what they need to get.
The argument that most plans being canceled are substandard is a way to justify the cancellations in spite of the president's promises that people could keep their plans and doctors, period, leaving no room for exceptions. Brett.
Jim, thank you.